Borderline personality occurs in the population with a prevalence of about 1.5 to 6%. That means that probably 2 to 6 people out of every 100 in the population suffers with borderline personality disorder. It is about 5 times more common among people who have a first-degree relative, so that means a parent or a sibling or a child who have borderline personality disorder. And it carries an increased risk in the family of substance abuse disorders, depression, antisocial personality disorder, and bipolar disorder. Borderline personality disorder is a pattern of instability. Instability in relationships, in mood and affect, and in a person's self-image, what they think about themselves. This starts in early adulthood and it persists for a number of years. For most people, after they reach their 30s, 40s, and older, the pattern tends to diminish and they may even become reasonably stable over time. According to the Diagnostic and Statistical Manual, which, by the way, I discuss in another video, the link is below, there are 9 specific criteria that can be applied to borderline personality disorder. In order to meet criteria and actually get the diagnosis, you have to have at least 5 of these criteria. I'll list them briefly and we'll talk about them a little bit. So, frantic efforts to avoid abandonment. People with borderline personality disorder are very sensitive to the environment around them, to changes in the environment, and any kind of perceived abandonment, anything that might be perceived as rejection or separation can lead to dramatic changes in self-image, cognition, and emotional state. So, for example, even a therapist saying that we're reaching the end of the hour and it's about time to stop, a friend saying that they need to leave, someone canceling an appointment or being a few minutes late. Any of those things could precipitate anger, even rage, and a tremendous amount of unrealistic upset, because the perception would be that I am no good, I am not liked, I am hated, and therefore, of course, I'm being abandoned. The fear of abandonment is therefore linked to an absolute intolerance of being alone. Oftentimes, people will develop all sorts of frantic behaviors to avoid being alone. Some of those behaviors include things like self-mutilation and threats of suicide. The second criteria in the DSM is a pattern of very intense relationships that also tend to be very unstable. Oftentimes, they're marked by alternating idealization and devaluation of the partner or caregiver or friend or relative or whoever this is. So the person with borderline personality might put someone up on a pedestal and think they're perfect and idealize them in every way very quickly and become very close to them and trust them a great deal and tell them all kinds of things, and then very quickly yank them down and become extremely disillusioned very quickly because maybe the person showed up late or canceled on them or disappointed them in some way, and vilify the person through a dramatic shift in their own viewpoint. These radical shifts are extremely difficult for other people to understand and generally result in destruction of relationship after relationship after relationship, and bring about the abandonment, which is exactly the thing that the person with borderline personality feared in the first place. The third criteria is a markedly unstable sense of self. So they may drift and change constantly and continuously between goals, plans, career plans, values. There may be very sudden and dramatic shifts in self-image, self-esteem, sexual identity, types of friends, vocational aspirations, just about everything. The next criteria is a tendency toward extreme impulsivity, and the impulsivity can be manifest in a variety of ways. They may gamble, they may binge eat, engage in dangerous and impulsive sex. They might drive recklessly, have repeated suicide attempts, or exhibit suicidal gestures and self-mutilation. Oftentimes, they engage in self-mutilation, such as cutting or burning, and they will state that it brings about a sense of relief. 8 to 10% of these individuals do complete suicide. Next is affective instability. That includes unstable mood, lots of swings in the mood. They can be intensely unhappy, extremely anxious, and have periods of rage, paranoia, and frank psychosis. Chronic feelings of emptiness. So I'm giving this criteria, which is not listed last in the DSM, but I am discussing last, its own slide because I think it is extremely important. Patients with borderline personality will talk to you about chronic feelings of emptiness and sometimes boredom. It's a terrible feeling on the inside that there's just nothing there. And they spend years and years looking for something to fill it up, whether it's sex or gambling or relationships or substance abuse or whatever, and nothing works. Sometimes the self-mutilation is an attempt to fill up that feeling of emptiness, and it is a chronically awful feeling. The abandonment panic is often related to the chronic feeling of emptiness as well. So what causes borderline personality disorder? The short answer is we don't know exactly, but we do have some ideas. The general consensus is that it's a variety of factors, probably combined. There is likely a genetic piece. We know that it runs in families, although the precise heredity and the precise genetics are not yet known. There appears to be some relationship between childhood abuse, early trauma, early separation from caregivers that may also be related, although not everyone who suffers from borderline personality has that history. Early emotional and physical neglect can also be related, as can insensitivity from parental figures or caregivers very early in childhood. The most current thinking is that there's a relationship between biological factors, so someone may have a vulnerability to the development of a borderline personality, and then certain environmental factors may trigger the evolution of those symptoms. Various biological studies have shown changes in the serotonin in the brain, and the limbic system may be related to the development of borderline personality. There is a specific type of neglectful or emotionally traumatic environment that some people experience as children called emotionally invalidating that can lead to borderline personality in some people. When our emotions are validated, it doesn't mean that someone agrees with us. It means that they are validated. So we feel that we are legitimate, that our emotions are legitimate, that we have a right to exist, that we have a right to feel what we're feeling. In an emotionally invalidating environment, the emotions, the feelings that are experienced by a child are either ignored or rejected or judged in some way, and the child is left to feel that they have no right to feel the way that they feel, or that their feelings are wrong in some way. The result is that the child grows up to learn their own thoughts, their own experiences are not worthy, are not correct, and they learn not to trust themselves, not to believe in themselves, Therefore, they experience low self-esteem, low feelings of self-worth, and everything that goes with that. So what can we do to help someone we love or to help ourselves if we've been diagnosed with borderline personality? Well, professional help can do a lot. Therapy, medicines, depression, anxiety, anger, all of those things can be treated. But there's a lot you can do for yourself, and there's a lot you can do for your loved one. As I mentioned a minute ago, having experienced an invalidating environment can be devastating. Learning how to validate yourself and your own emotions can be tremendously helpful. Or if it's your loved one, helping to validate your loved one's emotions and helping to give more validating responses can also be very helpful. I will discuss in another video in more detail the concept of validation, and we will work through some exercises in terms of validating emotions. But in brief, there are 3 steps: identify, acknowledge, and validate. So first is to identify and acknowledge the emotion. For example, if you are the one who's been diagnosed with borderline personality, after watching this video, you might understand why you feel rage because your husband, wife, girlfriend, child is 15 minutes late getting home. Perhaps you feel that familiar sense of fear of abandonment or loss or terrible anxiety. You can identify where that anger is coming from. The anger, the rage, isn't really over the lateness so much as it is a response to the fear that the lateness precipitated. Oftentimes, the person you are angry with will have no idea why you're angry, or even that you are angry. So it's important to use words and make a statement about how you are feeling. It's also helpful for your loved one to say back to you that they understand you're feeling angry. Other validating statements would be, that must have been very difficult for you, or I can see how hard that might be, or I can see you're really frustrated. Anything that supports and validates your emotions, anything that is not get over it, or you're too sensitive, or that's ridiculous, those sorts of emotionally invalidating statements. Next, it's important for you to know that your anger is warranted in the sense that all your feelings are warranted, all your feelings are valid. Feelings are not good, bad, right, wrong. They just are. They're like weather. So here's the thing about weather. You might like some of it sometimes more than you like it other times, but that doesn't make some weather better than other or right when other weather is wrong. Get it? So we've reviewed some of the basic symptoms and the diagnostic criteria for borderline personality and some of the causes. I will do another video talking more in depth about invalidating environments and some of the therapeutic approaches to treating borderline personality disorder. But for now, that's it. Thank you for listening. I'm Dr. Schwartz. This is Psych Talk, and I'll see you next time.